Welcome to the Dr. Edie Show. I'm Dr. Kimberly Edie. This is my channel on YouTube where I talk about a variety of topics. It's been a while since I last produced content. It's been 5 months basically. And I miss you guys and I'm back. But the reason why it's been a while is because, as y'all may know, I am a resident. I was an intern when I started this channel in family medicine. And as an intern, you get super busy on these rotations. I believe 5 months ago, I may have been on my OB rotation. I was delivering lots of babies, precious babies. And because of that, I was exhausted. So, and then of course, when I finished that rotation, it just led to the next one and the next one. And finally, I was able to finish my first year of intern year. And I am now officially a second year resident with Emory Family Medicine. And I'm super proud of it because it's a huge accomplishment. To say the least. So guys, what am I going to talk about today? I have no idea, but I do want to reinforce to y'all who are unvaccinated to get your vaccine. Please do. You see the cases on TV. I mean, as I'm currently on medical leave right now because I had to get some surgery done to take care of myself, and I'm doing good, by the way. I'm healing well, thanks to many prayers out there. But I've been following this Delta variant, and I'm sure y'all have been too. And you know, we all know that COVID is like, we need COVID to go away. Like, we need COVID to go bye-bye. But we also know that's not going to happen anytime soon. It's not going to happen until we all do our part to get vaccinated so that we can get this pandemic, make it not a pandemic anymore. So if you have not gotten vaccinated, whatever it is that's keeping you from getting vaccinated, I urge you to do your homework, do some research, talk to people, talk to your doctors, talk to people who've been sick before, find out their personal experiences with COVID to see if this is something you want to risk your life on by not getting vaccinated. Because I can tell you that getting the vaccine can save your life, because yes, you can get COVID. This Delta variant is very contagious and you still can get COVID with the vaccine. However, and I say however, your symptoms for the most part will not land you in a hospital in critical care and to where you need to be in ICU. And you're probably thinking to yourself, well, what's the big deal? What's ICU? I mean, they're gonna hook me up to, if I can't breathe, they'll just give me a breathing tube and, you know, let the machine breathe for me and keep me alive. And then my body will fight this illness and then I'll be fine. Well, we hope that's the case. But from my personal experience in treating patients back when I was on my ICU rotation who were in the ICU with COVID, unfortunately, a lot of them did not come off the ventilator. Once you're intubated, it's very difficult to extubate you, depending on the length of time that you've been intubated. And what that means is, if your body becomes ventilator dependent, your organs can start to shut down. And then eventually that can lead to death. And I'm sure you don't want to prematurely leave loved ones behind about a decision of whether or not you should get vaccinated because of what you heard about misinformation you've gotten from various unreliable sources, when there is the numbers to show you that this vaccine is safe and has been studied, and it is, you know, anecdotal evidence, clinical evidence to show you that the vaccine, compared to someone who's not vaccinated, far exceeds the benefits, and the risks are so little compared to those who are not vaccinated. So guys, please, I'm urging you to do your part to get vaccinated. I don't even know what else to say. If you have a question, obviously, you know, talk to your doctor to get that. You can drop a question below. If it's a reasonable question and I think it's worthwhile to respond to, I would definitely reply to it. But if it's a question or if it's a statement just being negative and poo-pooing vaccines, keep it to yourself, because you know, I'm all about saving lives, not about, you know, trying to be a part of some sort of agenda, that's out there. So for those who are vaccinated, you still want to do your part too. Mask up in public places because you don't know around who's vaccinated around you, who's not. You don't know who's sick around you, who's not. Asymptomatic people can still be carriers of the COVID virus, so protect yourself. Also, wash your hands and keep your distance. You know the drill. We've been through this for the past 18 months and it's not getting any better. So it's getting better because of the vaccine. We have that option, but in terms of like the information that's out there, nothing's really changed, except to, wear your mask, wash your hands, keep your distance. You can still go out and, eat out, at a restaurant, but try to find outdoor seating. And just know that risk is risk. Indoor is more riskier than outdoors, but the risk is still there regardless of the setting. So just, you make the decision, but I pray that you will make the decision to get the vaccine. Okay, moving on. So the next thing I wanted to talk about is self-care. Okay, so as a resident, we get so busy taking care of others that we oftentimes neglect ourselves in the process. And it's not because we are intentional and we are intentionally trying to neglect ourselves. It's that sometimes we just are too tired. Or if we do have the time, we just find an excuse to not take care of ourselves. It's very easy to make an excuse and just, grab one of these things and watch your favorite show, or just chill, with our lovely iPhones. And I'm looking for my iPhone. I realize I'm using it to record myself. So anyway, but it's very easy to forget and neglect our needs. And it's so important to take time out of your busy schedule to make your doctor's appointment, to go to the dentist to get your teeth clean, to, if you need some mental health, see a therapist, go for a walk, go for a bike ride, cook a meal for yourself. Don't be quick to go out and, that's my son. Don't be quick to go out and, get fast food for yourself. Just enjoy prepping something in the kitchen and exploring your creativity with a new recipe that you just found. So, try to do something for yourself. And that brings me to the whole surgery situation. So I did allude earlier that I had to get some surgery, one. Okay, so and with that, I had a hysterectomy, and it was not a total hysterectomy. It was a subcervical. It was a supracervical hysterectomy. Sorry about that. Supra means above the cervix. And why did I have to get that done? Well, it's because I had a history of fibroids. I'm one who I don't mind sharing my health things with people because I feel like it could help others. But basically, I had these fibroids that were growing and growing and growing over the years. And whenever I came on my monthly menstrual cycle, my cycles were getting heavier and heavier and heavier. Well, and of course I had some embarrassing moments too when you're in your cycle. And what ended up happening was I was becoming anemic. But this year I went to my gynecologist and he, was feeling around where my uterus was, and he realized that my uterus had grown in size at a rate that was concerning for him. And so, he recommended that I need a surgery. And of course, being a resident, I'm thinking to my surgery means time off. And how will I take time off from the patients that I'm caring for on a very busy schedule? And I was conflicted because I know I needed the surgery, but at the same time, what is that recovery time going to look like? And will that put me behind in my residency? Like all these thoughts start coming up. And then I had to think about this. If I'm not around, or if I'm unhealthy, life still goes on. But the people that mean the most to me, like my family, they would be the ones who would miss me, and they would be affected the most. So it's very important. It was a very important decision for me to move ahead with surgery. The concern that my gynecologist had with my fibroids growing at the rate they were, my uterus growing at the rate it was could it be a leiomyosarcoma? Of course, fibroids are benign tumors, benign meaning non-cancerous. And they usually grow at a certain rate. Some grow faster than others. But in my case, he was worried that my uterus almost doubled in size. You know, it went from like 10 centimeters to like 16 centimeters over in a year. And he's like, whoa, you know, that's concerning. And me, on the other hand, I'm like, should I not? But at the end of the day, I made the decision to get the surgery done. I had a hysterectomy. I could not get it done laparoscopically, where they make little bitty incisions, you know, in your abdomen to remove the uterus. I couldn't get it done that way because my uterus is too big. So I had to get it done through a surgical incision about 6 inches in length to remove my uterus. So I still have my ovaries. So I'm not going through premenopause, but I don't have to worry about those crazy, heavy menstrual cycles. And the good thing is that my pathology report came back benign. It was negative for any cancer, no sarcomas over here. So huge prayer and praise that that was the report that I got for myself. So I'm super happy that that's now behind me. I am 5 weeks after surgery right now, and I'm feeling great. I've been building up my strength. I've been walking a lot. Well, actually, I didn't walk yesterday, but I have been walking more and just trying to get back to being healthy again. So guys, I'm saying all this to say, don't neglect your health. Put your priorities where it needs to be. If you have to get surgery done, don't push it off. If your doctor's concerned, you know, if you need to get a second opinion, get a second opinion. But if your doctor's concerned and you trust their opinion, then you need to do what you got to do to take care of that. Okay. So I'm gonna leave this video here. I think the next video I want to do is I'm gonna make a video showing where I'm walking you through one of my favorite cookie recipes. It's a chocolate chip cookie recipe, and it is the best chocolate chip cookie. So stay tuned for that. You guys, you have to make sure you click subscribe to my channel so that you can be notified of new videos. And I promise there will be new videos that come your way. I might even do another one tonight, but more geared towards medicine for the new interns that are out there. But I just wanted to put this video together just to let you know that, hey, I'm still here. Please get your vaccine, and then please take care of yourself for some self-health, all right? Thanks for tuning in to the Dr. Edie Show, and I will catch up with you later. All right, bye.